The FDA finally approved the Pfizer vaccine this week. And although the light at the end of the COVID tunnel seems to be shining through, we noticed that there were a lot of questions on the validity of the vaccine, along with some people saying they weren't going to get it. To get some answers on questions we all might have, we spoke with a doctor who's been in the fight since the beginning, and not only that, but was also a part of the vaccine trials.
My name is Alejandro Comellas. I'm a pulmonologist and intensivist at the University of Iowa, and I am also a clinical investigator and scientist at the same institution.
Why is it that you want to particularly speak to this release of the vaccine?
I was one of the volunteers in the clinical trial for the vaccine for Pfizer, and I can testify what has been my experience, and also as a citizen, as a son, as a husband, as a father, as a neighbor. I understand really the consequences of this pandemic, and I think that the vaccine is really an exciting development that actually can change the whole battle that we have right now against this virus.
Based off your experience, what did you go through when you were part of the Pfizer vaccine trials?
Well, I volunteer, I send my information, I got invited to participate. I went to the site, which was at the university. I signed a consent, and I got my first dose. A day after my first dose, I was feeling fine. I had a little bit of just achiness and a little bit of pain at the site of the injection. Everything went well. And then I got my second dose around 2 to 3 weeks later. And everything was fine the first day. The second day, I had some low-grade fevers. I had a little bit of achiness and feeling a little bit of fatigue. But the next day, I was completely fine again. I was at 5 o'clock in the morning running with my dog without any problems. And since then, I have been doing really well. No new problems, no medical issues. So I can say that 4 months, because this happened in August or September, I can testify that actually I haven't had any problems after receiving the vaccine.
So you only experienced side effects within the 24 hours of the second dose?
Correct, and mine was mild. We know that they could be severe side effects every time you have any new medication. Basically, the majority of the patients, they just had mild side effects, and there were no side effects that really were severe in nature to the point that the person would end up in the hospital. So we were all really surprised at and also at the same time excited that this was done in 8 months. What was done really was cutting through a lot of red tape. They facilitated the implementation of the clinical trial, but the clinical trial follow all the regulations and maintain the integrity by going through phase 1, phase 2, and phase 3. Which are the different phases in which you look at safety and then you start looking at efficacy. In addition, all these trials, they had something called a data safety monitoring board, which is a group of people that actually are guaranteeing the integrity and the human protection of the research subjects. This vaccine is not new technology. This technology has been used in also cancer research trials in regards to vaccines against cancer. And the other thing which is important to know is that between the Pfizer vaccine trial and Moderna, there are basically close to 70,000 people that actually participated in this trial, and half of them got the vaccine. So we're talking about 35 to 37,000 people that received the vaccine. So we had a lot of people that actually got the vaccine, and we were able to follow these people now for 4 months, and the reports are very encouraging in regard to safety and efficacy of 95%.
When we all get the vaccine, when it's all available to the public and everybody is starting to receive it, What should the safety precautions look like? Should we still be wearing a mask out in public? Should we still be practicing social distancing for a bit?
That's a great question. So we know that the vaccine at this point, what we're able to look at is the efficacy in regards to development of symptoms related to COVID. We do not know whether if you get a vaccine that seems to be preventing you from development of symptomatic COVID, that means that you have cough, shortness of breath, fevers, whether the vaccine also will prevent from you being somebody who can infect others. So what we can say is that getting the vaccine is a way to prevent really the development of the disease, and we would hope that the vaccine actually would have an impact in the ability for the virus to infect others. But at this point, what we have to continue is to use our mask, face shields, the 6 feet distance, and then waiting for more data to come through, as well as waiting for the pandemic to be under control.